My name is Dr. Eduarda Batista and I'm a child and adolescent psychiatrist. Today we're going to talk about meltdowns and tantrums. So meltdowns and tantrums are emotional responses to a distressing situation. The difference between meltdowns and tantrums are huge, but they look very similar at the same time. So today we're going to try to differentiate between those two responses, and I hope that that's helpful when supporting your child or young person or a friend. Meltdowns are an emotional response to an overwhelming experience. What does that mean? This means that the brain is almost having a panic attack and it went into fight and flight mode. So the person lost the ability to think, to regulate themselves, and to direct their actions because it needed to escape a really overwhelming situation. So it's important to remember that meltdowns are a form of communicating distress, but it's not directed at anyone. Because a meltdown is such an intense response to something that is already overwhelming, the person can feel quite exhausted afterwards as well, and it might need just like a long period of time to recover from it. So it's important to remember that these are not just random or out of control moments. So a meltdown can happen in different situations. A response to sensory overload, emotional exhaustion, social anxiety, changes in routine. So during a meltdown, a person might show signs of extreme distress, such as like crying, kicking, screaming. But it's important to know that a meltdown can look different for every person, and it will probably also look different in different stages of life, depending on the situation, depending on what's happening. So you might also see people becoming really drawn and freezing and being unable to listen, to speak, to do anything. I think it's important to remember that that's an extreme reaction to an overwhelming feeling. So recognizing that that person is going through an extreme emotion, it will help you identify these signs quicker. So we're looking for signs of distress. So a meltdown is an emotional response to something that is overwhelming, and the brain just lost its capacity to think, to listen, to make decisions, and to regulate itself. So exceeded the capacity to just function. A tantrum, on the other hand, it hasn't quite yet exceeded that capacity to manage emotions and to respond. So that's why you see tantrums happening in young children, and that gets better over time. When supporting someone going through a meltdown, it's important to first remain calm, and that can be quite challenging. Seeing someone going through such distress, especially when it's someone that you love, that you care about, it can be quite challenging too. So it's normal to feel distress as well, but remaining calm it will help the person experiencing a meltdown to feel supported and to feel safe and to feel understood. When supporting someone having a meltdown, recognizing that they are overwhelmed by external factors might help to find ways to support them as well. So for example, trying to recognize what in the environment is also causing more distress can help as well to come with some strategies. So for example, during sensory overload, if there are bright lights, maybe turning off the lights, or if there's too much noise, helping the person to move to a more calm environment. If there is need for movement, offering fidgety toys or space for that person to move and pace around. So I guess that the idea is that you try to tune into the person's needs rather than trying to help them, trying to get them to snap out of it. So it's just allowing time and space for the brain to recover. So whether you are an autistic person yourself or supporting someone going through a meltdown, remember, meltdowns are not a failure. Meltdowns are a form of communicating distress and a form of communicating that is too much, and offering support. And with the right support, we can help each other navigate them. Thank you for watching.